As long as I can remember in this business, you have to do a dual scan in order to make a tissue-supported guide. Right? A tissue-supported guide has to meet the tissue intimately. There are a couple of different ways to achieve a well-fitting guide, or in Guided Smile, a well-fitting pin guide. Because as you know, it's a duplicate of the denture. You either do a hard reline or you do a wash impression. You put the markers on it, you seat it, you scan it in the mouth, you scan it by itself. That's the dual scan with the markers, right? I think we're kind of all familiar with the dual scan protocol. Again, as long as I can remember, the workaround to doing a hard reline, a little time consuming, it's not very cost effective, is to do a wash impression with blue or green mousse. And that is because for all these years, that was the only material that we found really worked because it had a similar density to resin as far as a CT scan was. The KV and the MA going through that prosthesis was just about the same as a denture. And so what you ended up with was a denture with the wash material and then an exact duplicate that we would print. You have, in this case, a pin guide, and in this case, a denture. They're the same. The trouble is that blue mousse and green mousse are expensive. They're almost $300 for the same volume that you can buy from this new material for about 1/4 the cost, $60, something like that, that you can buy this and you can complete just as many of them. And it is dense, and we have tested it. The density is the same. It makes an ideal surgical guide, tissue supported, or a pin guide. And this material is from a company that you're familiar with, more than likely, Kettenbach. Kettenbach sells this material called Silginat. Comes in a regular tube, works in a regular gun. You'll just do a reline wash impression of this. A little bit about the technique. You still want to use some type of tray adhesive, some type of bonding agent tray adhesive so it doesn't just pull out. So that hasn't changed. What is different is A, the material, and B, this material has the right viscosity for a wash impression. More like a medium body as opposed to greener mousse, which is a heavy body, brittle material. And you can load that up with blue mousse and it can open the bite, right? Because there's so much volume of material in there. Well, this, if you push hard enough, just like a regular wash material, you'll even see there's a little bit of burn through here in the Rugai right here. Because it's just a matter of how much pressure, or when the patient's biting, you can control how much and the material flow still remaining in the denture. A great product and a much lower cost for doing a wash impression for your dual scans.